St. Mary's Mission Hospital is a faith-based Level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
Hello there, good afternoon, and thank you so much for joining this discourse at Capuchin TV. As promised last Thursday, when we were having an introductory talk on St. Mary's Mission Hospitals with the CEO, Dr. Karen Owor. This is just one of the shows that we are going to be having every week. Now today in studio we are discussing fractures, and I have a guest, of course, from St. Mary's Mission Hospital, Dr. Kilonzo. Welcome.
Thank you very much.
Please tell our viewer who you are and what you do at St. Mary's Mission Hospital.
Good afternoon, viewers. My name is Dr. Peter Kilonzo. I work with the St. Mary's Mission Hospitals, Langata. I'm an orthopedic surgeon by specialization. Orthopedics, we deal with injuries to the skeletal system and any other defect affecting bone and joints.
Mm-hmm.
Yeah.
Thank you so much, and welcome to our studios. And my name is Sasha Elizabeth. Let's talk health. Okay, doctor, just to start, of course, fractures is something that's common. It's a common term, but could you briefly tell us what a fracture is before we go to the causes?
A fracture is a break of a bone, simply put.
Thank you so much. So what causes fractures?
The commonest cause of fractures is use of force, whether it's a person involved in an accident, hit with a rungu, or falls from a height. But occasionally, we have fractures not caused by trauma. And those ones we call fragility fractures. That means the bone was already weak, the bone was already sick. And therefore, by the mere use of weight of the person, the bone breaks.
Thank you. Now, what is the most single important thing that one can do when they suspect that they have a fracture?
Because fractures most often will be caused by a force. The most important thing is to stabilize that area. Don't continue using a limp unless there is very big danger. You're supposed to rest, splint or support the area which is injured as people look for assistance or to take you to hospital. Yes.
So there's nothing else that can be done, like tying, because we find that in some cases people find it ideal to tie the place.
No. What are you tying? You've no idea how the fracture looks like, because what you see on the skin is not what is happening. So what we normally allow is, if anything, apply a little pull and put something to support. Whether it's a carton, a piece of wood, sometimes like for the legs, we use the other limb, put them together and tie them around to support it. Because what causes most pain is the movement on the broken pieces. So once you support them and they're not moving, the person is very comfortable. And that is the most important first aid part of a fractured limb.
Okay. So it shouldn't, the patient should not try to hold it together with anything?
You can use anything which is hard, which is wood, carton, just to support it. And what you use to wrap around, make sure that it is not very tight, whether it's a belt, a shirt, or whatever you can get, tie around, but don't make it too tight.
All right. Now, what kind of treatments are available for the fractures?
Generally, we look at fractures in two types. There's what we call closed, where there is no opening on the skin, and open, where there is a wound communicating with the fracture site. Now, the treatment options will also depend on what part of which bone is fractured. For example, when somebody gets a fracture of the skull, Normally we don't support it. We don't put metals on it. But if you get a fracture of a long bone, the long bones are like the bones for the arm, the lower limbs, then you need to splint. Now, then the patient, you need to take an X-ray to know how is the fracture, so that now you can design what kind of treatment you have. The commonest way of treating fractures, and that is mainly for the limbs, is what we call plaster, which is splinting. The idea of splinting is to put the bones in line and support them so that they heal in line as near normal as possible. And that is the commonest way we put plaster, and there are many forms of plaster that we shall put. The good thing with the plaster is it's an outpatient procedure. The patient will be done the plaster and they go home on painkillers and they can heal on follow-up. It takes about 6 weeks in plaster. If a fracture is open, then normally we would opt to treat it by surgical management. You need to clean that area. What happens when the skin is open, some bacteria will get in. Some soil, some grass, some kideri will get in. So you need to clean that area and close the wound. And then start dealing with the fracture. What people should not assume is that the skin is not important when you have a fracture. It is the most important part of covering. Any bone which is left out for some time will die because it gets its food and oxygen from the skin and the surrounding muscles. So when a fracture is open, then the most important thing at that time to sort out will be the muscle and the skin and to close it. Now, a fracture which is open, and also depends on the size of the wound, we want to manage by fixing it surgically. And normally we use something that we put outside the bone. The reason is anything inside a potentially infected area will most likely get infected. So anything under the skin, we don't want. Want something that is on top. Now, it goes by the name of an external fixator. Kwa kijiji, it has many names. Some people call it aerios, others call it chuma ya inje, but it's technically called an external fixator. Now, for the other fractures which are closed, it depends on where it is. There are fractures where 100% you have to operate because anything else does not give you good results.
Okay, so now once the patient gets to hospital, what's the first step? Do you perform some imaging to establish the nature of the fracture?
Yes, the commonest thing that we'll do to a patient who has had a fracture is an X-ray, which is available in most places. And therefore, we will always advise that don't try to manipulate the fracture if you have not seen the X-ray. You can make it worse. You can injure other surrounding structures. So once you see the X-ray, if it is enough, then you go ahead and manage your patient. If it is not enough, then you go to the second modality, which is a CT scan. Usually those two will sort us out in terms of what to do. So if we decide to operate, now there are many things that you'll do, depending on the age of the patient, where the fracture is, and we'll put some kind of a metal, which is usually inside. Metals come in many forms. There's what we call nails. Nails are put inside the marrow. There are plates which we put on top of the bone. There are wires which will be half inside and half outside. And there are many forms, now depending on the fracture.
Now, you've mentioned, you've brought in the aspect of age. Does age affect the time of healing for anyone with a fracture?
Yes, children have got the best healing time. Within 2 weeks, 4 weeks, you'll get enough newborn forming. So for children, we are always very happy to do as little as we can because nature takes care of them. As the age progresses, on average, we'll give ourselves 6 weeks. But with age and other diseases that affect our patients, then healing gets slower. Now, any bone which is not covered adequately by muscle usually heals worst. Now, for example, if you look at your leg, there is a bone that is very prominent there. Every time you eat anything, it is always the one which is hit. because it's exposed. That bone heals very poorly. We call it the tibia because it doesn't have a lot of blood supply. Quite a bit, about 40% of its surface doesn't have muscle. It's only the skin. The skin doesn't have a lot of blood, but muscles do. So any bone which is wrapped up very nicely in muscle heals very well.
Thank you so much, Dr. Kilonzo. Now, just like any other injury on the skeletal system, fractures have got their own complications. Could you please share with us the complications, the most common complications of fractures?
Yes. If you look at your height is maintained by bones. If you break your bone, it will definitely look shorter. Your forearm will look shorter. And that happens every, it maintains shape, length, structure, and it's one which carries us all along. So now when you get a fracture, if it is not well aligned, you can get shortening. So you'll get one fellow who got a fracture and all of a sudden he's walking like one leg is up half of the other one. That is shortening because the alignment was not perfect or there's a problem with the joint, but the commonest is overlap of the fragments. So that's why we said supporting is important, so that when you reduce as anatomical as you can. The second one, and this is what we fear quite a lot, is infections. If the bone has gone out of the skin, what we are calling open fractures, you'll get infections. And one of the things that we are very scared of is infections of bone. And we usually say the patient is now a permanent patient to us because it's very difficult to clear infection from bone. The other one is there is pressure on surrounding structures. Remember, bone is the deepest structure. Outside, there is muscle, there is skin, there is nerves, there is blood vessels. So if a fracture occurs and there is pressure on a blood vessel, that limb will die. And from a fracture, you can get an amputation. If you injure a nerve, the muscles farther away from where the nerve serves will get paralyzed. Then that limb is not very useful. If the fracture involves the joint, later on we develop, there is wear and tear of the cartilage, we get what we call osteoarthritis of that joint. And some bones, when they fracture, they injure their own blood supply. So the part that does not have blood supply dies. And therefore you'll get a piece of the bone looking like it's dying on its own. We call it necrosis. Those are the common ones.
Okay, is it possible to get a fracture without being involved in any form of an accident?
Yes, we call them fragility fractures, and we are saying that a bone which is weak, from the various reasons that can make a bone weak, from infections to cancer to birth defects, that bone will just fracture when the fellow is not doing anything. We'll try to lift a cup of tea and you get a fracture.
Wow.
That is possible. Somebody is just standing up and then they collapse.
Thank you so much, Dr. Kilonzo. Right now we take a brief break and we'll be right back with more on fractures with Dr. Kilonzo, an orthopedic surgeon. Stay with us.
St. Mary's Mission Hospital is a faith-based level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department. and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana. Na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
Coronavirus COVID-19 is a respiratory virus spreading across the world. The infection is spread from droplets of coughing and sneezing of an infected person, touching or shaking hands, or being in contact with contaminated surfaces or objects with the virus. The signs and symptoms are fever, coughing, headache, body ache, difficulty in breathing. The disease can be prevented by regularly washing hands with soap and running water. Avoid close contact with people who have flu-like symptoms. Avoid handshake, hugs, and kissing. Also, protect yourself by covering your mouth or nose using a disposable tissue while coughing or sneezing. If you experience these symptoms and you had traveled or been in contact with a person from a country reporting COVID-19, you should isolate yourself for 14 days and seek immediate medical attention or report to the nearest health center. This message has been brought to you by the Government of Kenya and its partners. For accurate information on COVID-19, dial *719# or call 719. Follow us on Twitter at MOH_Kenya, at spokesperson GOK, at WHO.
Kitubio au upatanisho. Sakramenti ya kitubio ndiyo sakramenti ya kuondolea watu dhambi walizotenda baada ya ubatizo. Sakramenti ya kitubio pia huitwa sakramenti ya upatanisho, ipo katika fungu la sakramenti za uponyaji. Kuna sakramenti mbili za uponyaji, kitubio na mpako mtakatifu wa wagonjwa. Dhumuni haswa la sakramenti ya uponyaji ni kuzirejeshea uhai roho zetu pale zinapougua kwa kutenda dhambi. Yesu ndiye tabibu mkuu wa roho zetu, naye yu tayari kututibu kila tunapougua.
Kupata kitubio kama Skiza Tune yako, tuma neno Skiza likifuatwa na nambari 738100273 kwa 811.
St. Mary's Mission Hospital is a faith-based Level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa hivi mtoto wangu anakula, anacheza, ananyonya, nafurahia sana na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyo mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion. In healthcare.
All right, welcome back to this discourse right here on Capuchin TV. We are enlightening you on fractures, which are common injuries that happen. And of course, before we went for a break, we heard about the abnormal kind of fractures, which doctor calls them fragility. Now, if you have just tuned in, I am with Dr. Peter Kilonzo from St. Mary's Mission Hospital, who is an orthopedic surgeon. Doctor, welcome to our second session.
Thank you very much.
Now, as I said before we went for a brief break, we mentioned fragility fractures. What kind of investigations are recommended for people with fragility fractures?
Now, fragility fractures become very tricky in terms of investigations. They are not as straightforward as trauma-induced. Mm-hmm. Because when a patient gets a fragility fracture, then the question is, what is the likely cause? Mm-hmm. Now, in medicine, we have things we call differentials. Differentials is, number one, what is the most likely cause? Followed by number two, number three. So that when I prioritize my investigations, I want to start with number one. Mm-hmm. If I get a man who is 50, 60 years old and has got a fragility fracture, mm-hmm. my first question is it cancer of the prostate? So my energies will be directed at that. If I think it is cancer, then I'll think about what is the commonest cancer in more. We call it multiple myeloma. Mm-hmm. I direct my investigations in that direction. So if you think cancer, then you look at the age of your patient, the gender of your patient, and if it's a female, of course, what comes to mind very fast, cancer of the breast, cancer of the cervix. Is it a GIT tumor, gastrointestinal tumor? Is it a thyroid? And then you'll direct your investigations along that. If it's a child, then now you start wondering, is this fellow from Western? Is he a sickle cell anemia person? Then you investigate along that. Mm-hmm. Is it just an infection of the bone? And if so, what is causing it? Then you investigate along that. So it becomes wider and a bit more difficult with fragility fractures to investigate.
Okay. All right. Thank you so much for that important explanation. So it could be sometimes it's a symptom or a sign of an underlying ailment.
Yes.
Great. So now, some of us, some people, some patients, so once they get treated in the hospital or they get cemented, they feel like they are okay, they can stay at home. What kind of follow-ups are necessary for patients with fractures?
Now, let me from the onset say that follow-up is probably as important as the treatment. And we always say that rehabilitation part of treatment of fractures is mandatory. We underline it. It is not like splintering, because splintering is if necessary. I'll fix your fracture if necessary, but rehabilitation is for 100% of all the fractures. Now, any patient who has had a plaster put in their limbs, they must be seen within 24 hours by somebody who knows what to look for. And the reason is, when you put a plaster around the limb, which was injured in the morning, the limb is likely to swell. Then the plaster will get tight. When it gets tight, it will block the blood supply. What happens when without blood supply? The limb will die. Now you can see it's very important that this patient comes back the next day. They should not think that because their fracture has been sorted out, the pain is less, now they can just go and stay at home. Now, the rehabilitation part, we expect fractures to heal in 6 weeks. But patients need to be followed up to check one, is the alignment that we achieved when we were treating the fracture maintained. So we need to take another X-ray, for example, to make sure the alignment is good. There is also physiotherapy. And physiotherapy is part of the rehabilitation, which is a must and should be started as early as possible. When we put implants on fractures, when we fix them with metals, we normally say, start your exercises tomorrow. Start moving the joints, and we want movement for all the joints. Something like the hand is so sensitive to staying in one position that it will become stiff within something like two weeks. So if this patient does not think exercise is important, he'll have a very nice anatomically looking hand, but the function is very poor. Because the hand makes very many movements, and the earlier we start the rehabilitation program, the better. Now, rehabilitation also goes with what you might have lost. If, for example, in the accident, you did not only get a fracture, but you also lost the thumb, for example, or a finger, or a limb, then we need to start training you on how to survive without it. Sometimes it calls for a change in the profession. If as a surgeon I lose a hand, that's a very serious loss because I use my hand to do literally everything. So somebody will have to take me through a training program on how to deal with my activities without what I lost. So the rehabilitation part is very, very important. And once you are treated, always come back for rehabilitation.
Thank you so much, doctor. Now, a fracture can happen on different tissues on the skeletal system. So someone could ask, are bone fractures permanent, or they can be healed completely or fully?
Bone is one of the most forgiving tissues that we ever got from God, because it tries as much as possible to heal. So most fractures will heal. What we try to do in treatment is not to fasten the healing, but to make sure that the healing occurs in the proper positioning, anatomical positioning. If the fracture overlaps, it will heal, but the limb will be shortened. At that point, the problem is not the bone, but the tissues are short and the function is poor. So people should always remember that bones will always heal. What we do in medicine is to try to heal with comfort and in the correct anatomical position. A few are stubborn, they heal poorly, and those are the ones who want to intervene early.
All right, so and what's the cost of care? How affordable or how costly is treatment and management of fractures?
Fracture management can occupy either extremes of costs. It can be very cheap. If you get a fracture of the rib, if there is no other complication, normally you don't need anything. We never fix fractures of the rib. If you get a fractures of the forehead, unless there is a complication with the brain, we don't normally do much. That is easy. But the common fractures that we need to manage are fractures of the limbs, the hands and the legs. And any fracture which does not need to be fixed is cheap to manage because we don't need to put plaster, give painkillers. A plaster cost will be anything between 2,000 to 5,000, depending on what you want to use. Also depending on the size of the patient. If you get these patients who are several megabytes and the thigh is so big, then you use a lot of plaster to apply. Of course, that is cost because it's per unit. If you get some of these fellows who are just as slim as me, then putting a plaster becomes a cheap exercise. So the size of the patient is also important. Now, if a fracture is open and you need to operate, then you are talking about, depending on the hospital you go to, a fairly priced private hospital should be able to get it at around 100,000, 150,000. Of course, the high-end hospitals will charge differently. If you have to fix the fracture which is closed, it will be in the tune of around, again, from around 60,000 to around 150 on the fairly priced hospitals. Of course, going to the other side, because it depends on the cost of the implant, which implant you are putting, what metal makes the implant, who puts it, what is the daily charge for the hospital, and so on. And we appreciate that NHIF came in strongly in supporting patients for the treatment of fractures because now they are paying a package which is reasonable enough to have these fractures fixed at a fairly priced hospital, which we do in St. Mary's.
Wow, wonderful. Now, metal implants. What determines if the patient needs to have a metal implant?
Now,
what is the determinant?
The determinant is what kind of a fracture you have. There are fractures which 100% we fix. A fracture which involves a joint, we fix 100%. Because the function is never good if you don't try to get as much anatomy resemblance as possible. That is one. Long bone fractures, we also want to treat them with fractures. Fractures of the femur, the bone that connects the lower limb to the pelvis. We always manage them surgically. Now the reason is the other option is long, expensive, and cumbersome because you'll have to stay in bed for between 6 to 12 weeks. And we pull that leg and therefore you cannot get out of bed, you cannot eat. It's difficult management. So we go for the better option, which is fixing. In terms of cost, operating in that case is cheaper than any other. This patient will be in hospital for about 3 days. They'll start going about their activities at home. They'll be walking, they might not put on weight, and if they can work from home, compared to the other option where they have to stay in hospital for 6 weeks, they have to eat in hospital, they might get infections, they might get complications, relatives have to come every other day carrying bananas to see them, they stop working, so there's a lot of economic loss in terms of treating fractures conservatively. The other thing is also how the fracture is. There are some fractures, for example in children, where the two pieces are so far apart and you try to bring them close, it's impossible. You have to hold them in position using a metal.
Thank you so much, Dr. Kilonzo. Now, as we head towards the end of this discussion, I understand that you offer orthopedic services at St. Mary's Mission Hospital. Could you please tell us how different or how unique are your services compared to other facilities that offer the same services?
Yes, I must say that in St. Mary's we are top of the range in terms of offering orthopedic services. Now, one of the things that is most painful is a fracture. And the fractures need to be treated as soon as possible. And in St. Mary's, we do that. We want you to come in the morning. We want to fix you the same day, unless you have got other issues. Some of the issues that come in, of course, will be costs or other injuries that the patient sustained. So that is number one, efficiency. The other one is follow-up. We are able to follow up our patients very efficiently. We have got a very functional physiotherapy department to rehabilitate all our patients. And the third is costs. I think we are the most fairly priced hospital in this town, apart from what is government. And cost is one of the biggest impediments to access to healthcare. And we are very friendly, and on top of that, we shall pray for our patients.
Wow, thank you so much, and that brings us to the end of our discussion. But one most important thing, Doctor, when do you offer your orthopedic services rather?
Now, the orthopedic services will be divided into two: the emergency service, which is daily, 24/7, and the elective or the clinic services, where we book our patients for Thursdays. The clinic is only for people who are just coming from home. They have a condition which can wait. But for emergency patients who have had trauma, we manage them daily.
Thank you so much, Doctor, for your time and for enlightening us on fractures, and more importantly about the services, the orthopedic services at St. Mary's Mission Hospital. Now, that's Dr. Kilonzo Peter, an orthopedic surgeon from St. Mary's Mission Hospital. This was just a second talk after the introductory talk that we had last week on Thursday. And we shall keep on bringing such informative discussions on health to enlighten you on different health conditions, how to treat and manage them. Thank you so much for being with us since we started. And as we wrap up, I would like to extend my gratitudes first and foremost to you for taking your time to follow this discourse. And I would also like to thank the people behind the scenes who have ensured that this program comes to you in the best way possible. And this is Evans Havana and Felix Nyabuto, who are camera operators, our visual mixer Gillian Mwangi, our transmitter Peter Mwangi, and of course our sound engineer Frederick Ocheng, aka DJ Fredox. My name is Sasha Elizabeth. Thank you so much and see you next week. Goodbye.